Did you know when it comes to picking the exact right health insurance plan for you that there's really only three things to keep in mind? Well, today I'm going to show you exactly what those three things are and how you can find the exact plan for your specific needs. Hi, my name is Joel. I'm the owner of Affordable Coverage Now and affordablecoveragenow.org. And today we're going to go through what are the key areas of focus when you're picking a health insurance plan for you, your family, or even your business. So let's get right into it. Step one. Well, step one is to actually understand how important it is to have health insurance coverage in the first place. Why do you even need it? Well, the big area in my mind is for financial security. Because having health insurance gives you, yes, access to quality care, and in a life-altering emergency, it can be a total life or death decision whether you have access to an emergency room or not, having health insurance. But accidents and illnesses can happen to literally anyone, and if you don't have health insurance, you could be facing astronomical costs as it relates to something like that happening, and therefore protecting your financial security and access to quality health care will give you that peace of mind you need, and therefore that's why someone would need health insurance in the first place. Now that we know why we need health insurance, step two becomes, how are you going to use your plan? And that's a question I've asked thousands of times. Based on thousands of responses to that specific question, how are you going to use it? I've come up with three specific categories of person and really of plan. The three categories are this. Category number one, hopefully never going to use it. Category two, I use it regularly. And category three, I want the best of both worlds. So let's talk quickly about each of those. So category one, the people who hopefully never need to use their health insurance plan. Sometimes these are the folks that just stay the heck away from the medical system altogether. And I've talked to hundreds and hundreds of folks just like that. And that's great if that's you. Now you also know though, the need in the event of something catastrophic happening, illness or accident, you know that you need that protection in place to shore up costs in the event of a huge, expense. And so these plans can have maybe higher deductibles, but that's okay to that type of person if that's you, because paying $8,000 or $10,000 in a deductible is a whole heck of a lot better than paying $80,000 or $100,000 in hospital bills. So a catastrophic only type plan is, or a catastrophic heavy type plan is category number one, and it's usually associated with a lower monthly cost or a lower monthly premium. Category number two then is somebody who uses the plan regularly. So this person maybe has a maintenance chronic disease, they need maintenance medication, maybe they need routine checkups. Maybe you're just somebody who likes to get your labs drawn 2 to 3 times a year to see what your blood, what your levels are at. Maybe you need an annual physical. Maybe you're a family with active children in school who get sick and need urgent care visits and need physicals for sports and need doctor's checkups, etc. So that category, a regular use type category, corresponds to a plan that does a great job of what I call the day-to-day coverage. Again, doctor's visits, primary care, specialist visits, urgent care visits, even telemedicine, prescriptions, stuff like that I call the day-to-day coverage. And if you're in this category, you're going to want a plan that's what's called an MEC type plan or a minimum essential coverage type plan. Those plans cover preventative things 100%, and they do a good job of covering day-to-day stuff like we mentioned. And as far as price goes, the MEC type plans are going to be middle of the road. So then the third option is, well, how are you going to use your plan? Well, I plan to use it regularly, and I need something there that is going to do a great job in the event of catastrophic events. I call these the comprehensive plans or comprehensive coverage, also known as the Cadillac plan. And so if you're somebody who wants the Cadillac plan, that's great. You're going to have something in place whether you have day-to-day expenses, day-to-day access to things, or a catastrophic event, and everywhere in between. And so as you might imagine, the comprehensive type plan is the plan that's going to cost most as well. Now that you know what type of plan you prefer, how you're going to use it, why it's important to have it in the first place, it's important to next consider what's your budget. So there's a key distinction between the type of coverage you want and the type of coverage you can afford. And of course, taking into account income, expenses, and savings. Now, some will say, and I actually agree with this to a certain extent, that you really can't afford to be without good coverage because the number one cause of bankruptcy in the United States is extreme medical bills, catastrophic medical hospital bills, etc. And so to protect your financial assets, you can look at health insurance as the best thing for your budget would be to do that, to protect your financial assets. And based on the types of plans we just talked about, again, catastrophic plans only are going to be on the lower end of the spectrum, and some MEC plans like bare bones access to day-to-day coverage is also on the low end of the spectrum. And you can get, a little bit middle of the road with MEC plans or catastrophic plans, depending on what they cover. On the high end of the spectrum, of course, is your full comprehensive coverage type plan. So it's just a matter of determining, again, which plan is the right fit for you and where does that fit within your budget. So now you know why you need it. Now you know how you're going to use it and also what your budget is. The last step then is, where do I get a plan? How do I shop for plans? Well, there's really 3 categories in this answer as well, and I'll go through those quickly with you. First place to get health insurance would be your employer. Maybe you're at a job and maybe you didn't know they offer benefits. I recommend going to talk to your HR provider. Your HR representative will be able to tell you what types of plans are offered and what the benefit is to you, how the company handles those. So some employers pay for all of your benefits. That's a best case scenario. Go for it. If your employer is paying for your benefits, take them up on that. Some employers pay for the employee-only cost, and like if you wanted to add your family, you got to pay for that. And sometimes that's so expensive that makes people come out into the private marketplace and look for something else. Also with employers, there is sometimes limited options like, hey, this is your plan, and you just don't really get to kind of pick what coverage you want. So number 1 is employer plans, a good option typically. Number 2 place to shop for plans would be the marketplace. We call the healthcare exchange or the healthcare marketplace. This is where you go to healthcare.gov if you're in the United States, and then you're going to pick your state. What state do you live in? Each state has its own Department of Insurance, and therefore it has its own healthcare marketplace exchange. And then you can shop for plans there. The benefit is, if you qualify, you might have the opportunity for the government to pay a portion of your health insurance premiums each month, therefore lessening your expense every month. The catch-22 with that, though, is if you don't qualify, number 1, you might have to pay all of that back at the end of the year if you make too much money, for example. $1 more than the limit that they set, and you at tax time, you'll have to pay all of that back. Every month, they paid a portion of your premiums, and all of a sudden you made too much money that year, you got to pay that back on your taxes. Ouch. And we've seen that happen. And then the other side of it is, depending on your income, your filing status, your, etc., you may not even qualify for a subsidy at all, and it's going to cost an arm and a leg for you to find a plan. Those plans can be very, very costly. And so therefore I don't love that option it's not my favorite option. Now my favorite option is number 3, and that's working with an independent broker like Affordable Coverage Now. You maybe know a broker, speak to them, because a broker, health insurance broker, is someone who represents you. By contrast, an agent is somebody who typically represents the company they work for and can only sell the products within that company or within that health insurance company. A broker, on the other hand, represents you and can offer you multiple different products from different companies based on what fits you best. So working with a broker like AffordableCoverageNow.org is going to be in your best interest, because somebody can guide you through, help you understand, and also get you into the plan that best fits your needs. Visit AffordableCoverageNow.org for more information. Now, I will say that our phone lines are very, very busy. We do have a team of brokers. Like I said, our call volume is high, but go ahead and drop us a line. You might be able to schedule a call as well, and we'd be happy to help. So there you have it. You have the 4 steps to choosing the exact right health insurance plan for you. If this provided you value, please drop a like, drop a comment below if you have another topic you'd like me to cover, if you have a question on anything I just covered. Additionally, subscribe to the channel. That really helps us out. Thanks so much for watching.